Every year in the United States, over 2 million patients are diagnosed with cataracts. A cataract is a clouding of the eye's natural lens inside the eye, just behind the pupil. Before a cataract develops, the eye's natural lens is clear, allowing light rays to pass through it to focus clearly on the retina. But over time, the natural lens becomes cloudy, blocking light rays from reaching the retina. Cataracts cause our vision to blur and our color perception to diminish. Left untreated, cataracts could eventually continue to develop to the point of causing blindness. In order to see clearly again, the natural cloudy lens needs to be surgically removed. And in its place, an artificial intraocular lens, or IOL, will be implanted. There are many types of intraocular lenses that will clear the distorted vision of the cataract along with any nearsightedness or farsightedness that you may have. A standard monofocal IOL will provide excellent vision at one point of focus, usually at a distance. However, many people also have some degree of astigmatism. Astigmatism occurs when the cornea, or outer window of the eye, is more curved in one direction than the other. This causes multiple points of focus and blurry vision. Today, patients with astigmatism who want increased freedom from glasses after cataract surgery can choose to have their astigmatism corrected with laser cataract surgery, or a toric IOL, to reduce or eliminate the blurring and distortion caused by astigmatism. Many IOLs also have an aspheric surface that is proved to eliminate much of the night vision distortions and loss of contrast that can be experienced with standard IOLs. Some patients elect to have monovision with monofocal IOLs. With monovision, the dominant eye is corrected for clear distance vision, and the non-dominant eye is corrected to see near objects. Your brain will automatically select the image you want to see. Monovision is a viable option for some patients, but not tolerated well in other patients. There are also a number of advanced IOLs available today that can provide a full range of vision in both eyes and can also correct astigmatism, allowing you to read, see clearly in the distance, and objects in between, with little or no dependence on corrective lenses for most of your activities. Which IOL is best for you depends on the unique characteristics of your eye as well as your lifestyle needs. You and your doctor will make this decision together. Your procedure will be performed on an outpatient basis. Your eye will be completely numbed with topical or local anesthesia. Bladeless laser cataract surgery has significantly improved the precision of several of the most critical steps that were performed manually with traditional cataract surgery. To begin, primary and secondary stair-step incisions are created on the edge of the cornea with the laser instead of with a blade to provide access to the cataract. If a patient has pre-existing astigmatism, arc-like incisions in the outer margins of the cornea are made to correct the astigmatism. These laser incisions are considerably more precise and predictable than those created by a blade. The laser then creates an opening called a capsulorhexis in the thin capsular membrane that surrounds the natural lens to provide an opening to remove the cataract. Studies have shown that a capsulorhexis made with the laser is 10 times more accurate than a manual capsulorhexis, which is made with a bent or shaped needle. In order to remove the cataract, the lens must be divided into manageable sections. This step is now performed in seconds and with much less energy with the femtosecond laser. Moreover, with laser cataract surgery, the femtosecond laser actually softens the cataract, so less ultrasonic energy is required during the removal process. This means there is less stress to the delicate fibers and capsular membrane that hold the intraocular lens in place. Once the cataract is removed, the intraocular lens of your choice is inserted through the self-sealing incision and locked into position. Typically, no sutures are required. For your short and long-term success and satisfaction, it is essential that you strictly follow all instructions given to you regarding medications and follow-up appointments. After the procedure, have someone drive you home. You should just relax and enjoy the rest of the day and avoid any strenuous activity. You may experience mild discomfort for the first 24 hours. But if you experience pain that cannot be relieved with medication, you should call the office immediately. Everyone heals somewhat differently, but many patients report improvement in their vision almost immediately after the procedure. Most patients return to their normal activities within a day or two. It is important that you understand that virtually everyone will experience improvement in their vision after surgery, but some people will not see 20/20 at all distances or in all light levels. This can be influenced by the overall health of your eye, the condition of your retina, and the unique optical characteristics of the IOL. Also, as we get older, our ability to see in low light may start to decrease naturally, so it's always best to read under good light conditions. Although most patients are satisfied with their vision after lens implant surgery, it is not uncommon to wear glasses for certain tasks, particularly at night or in dim light. It may take several months for your eye to reach its full focusing potential. Your vision can continue to improve for up to 12 months. The second eye will usually be done soon after you regain visual function in the first eye. If you had your astigmatism corrected with laser cataract surgery, there is a possibility that the effect will diminish over time and could possibly require retreatment. If the IOL selected does not correct all of your nearsightedness, farsightedness, or astigmatism, it may be possible to refine your vision with laser vision correction or additional refractive surgical procedures. Months or even years after cataract surgery, it is possible to experience cloudy and blurry vision, similar to what you experienced when you had a cataract. This is known as a secondary cataract. A secondary cataract is a clouding of the capsular membrane that originally surrounded the natural lens and now holds your intraocular lens in place. In order to restore clear vision, the cloudy membrane is opened with a brief and painless procedure known as a YAG capsulotomy. You should also understand that it is possible that your surgeon may encounter a condition or complication that will prevent you from having the type of lens implant that you chose prior to the procedure. It is also possible that the lens implant power measurements may give results that significantly vary from what was intended, resulting in the need for corrective lenses, surgical replacement of the intraocular lens, or other vision correction options. Usually, this would be done a few months after your IOL procedure and may involve additional costs. Although cataract surgery is among the safest medical procedures performed today, side effects and complications can occur. Some of these complications include severe infection or bleeding, macular or corneal edema, glaucoma, chronic inflammation, IOL dislocation possibly requiring removal or replacement, droopy eyelid, posterior capsular opacification, retinal detachment, especially for patients who are very nearsighted, residual nearsightedness or farsightedness, increased astigmatism, double vision, ghost images, impaired depth perception, trouble driving at night, loss of vision, and even loss of the eye. This list of potential complications is incomplete, as a short program such as this cannot cover all of the potential risks and complications associated with cataract surgery. You will be given additional information on complications and specific information about the type of IOL you will be receiving prior to having the procedure. Ultimately, only you can make the decision to have surgery, and that decision needs to be based on your knowledge of both the risks as well as the benefits of the procedure. If you choose to have a premium IOL, such as a toric, or an accommodating or multifocal presbyopia correcting IOL to reduce or eliminate your dependence on glasses or contact lenses after surgery, it is important to understand that you may not achieve the results you desire, and your doctor cannot guarantee your results. Should you choose to have a multifocal IOL, you may experience glare and halos around lights, especially when driving at night. Most patients report this visual side effect diminishes in intensity as the brain gets used to the IOL, but they may not go away completely. There are also a number of financial implications you should consider. If you have cataracts and are over the age of 65, Medicare will pay for the cataract surgery and a monofocal IOL, but not a premium IOL or laser cataract surgery. You will be responsible for the additional cost of both the premium IOL and the additional physician services you will receive. If you have cataracts and you are under age 65, your private insurance may pay for the cataract surgery and a monofocal IOL, but not a premium IOL or laser cataract surgery. Now, let's try a short quiz to see how well you understood the information in the program. Please circle true or false on your answer sheet. 1. It may take months to a year for your eyes to reach their full focusing potential. 2. You may notice glare and halos around lights, especially at night, and these visual side effects may not go away completely. 3. If you choose a premium IOL, you will be responsible for the additional costs. 4. You may need to wear glasses from time to time after surgery, especially at night or in low light levels. 5. It is not important to keep your follow-up appointments after surgery. 6. Your doctor cannot guarantee that you will have the results you desire after the procedure. 7. Monofocal IOLs provide a full range of vision from near to distant. 8. If you have astigmatism, it may require correcting with a toric IOL or laser cataract surgery during your procedure, or laser vision correction after the procedure. 9. It is possible that during the procedure, it may become necessary to implant a different type of IOL, other than the one planned. 10. This video contained a list of all potential risks, complications, and side effects that could possibly occur. When you have completed this quiz, please grade your own test by comparing your answers to those found on the bottom of the page. You will also be given a written informed consent that covers additional information regarding risks and complications. Please read this document thoroughly and have all your questions answered by your doctor or a staff member before signing this document. Don't rely just on this program to make your decision whether to have the procedure. Thank you for your trust and confidence in choosing our clinic for your vision correction needs.